Today we're going to talk about our presentation for our research today, which is about the effect of supernatural beliefs on mental health, help-seeking behavior amongst medical students at Ain Shams University in Egypt. So let's talk about the introduction first of all. So mental health disorders, they are amongst one of the most clinically significant disturbances, whether in cognition, whether in emotional regulation, or whether in behavior. Mental health disorders are a major global health burden. So they are among the leading causes of disability worldwide. Anxiety and depression alone, they contribute significantly to global disability and also economic growth. Despite all of this happening, a large treatment gap exists, which particularly happens often in low-income and middle-income countries such as Egypt. So approximately 75 to 90% of individuals in these regions, they do not receive adequate mental health. So let's talk about medical students. Medical students are a very high-risk group for psychological distress. Psychological distress includes stress, fatigue, burning out, and depression. So let's talk about stigmas and barriers. Mental health stigmas remain a major barrier to help seeking, and especially in conservative and secretive societies, such as the Egyptian society. Amongst medical students, fear of judgment, confidentiality concerns, and professional consequences, they further reduce help-seeking behavior. Let's talk about the cultural context. In many Middle Eastern and North African countries, mental illnesses are often explained through supernatural beliefs rather than biomedical and factual models. So common supernatural beliefs include jinn possession, the evil eye, and black magic. Such beliefs, they may influence how individuals interpret these symptoms and decide whether or not they could seek help.
Let's talk about the gap. There are limited quantitative data that links the supernatural beliefs to the help-seeking behavior, but especially between the Egyptian medical students. The existing studies either focus on the culture or the help-seeking, not the relation between them. Our main goal is to develop targeted educational program that promotes early help-seeking and reduce the stigma. Our main objectives is to assess the level of supernatural beliefs among medical students using the SAQ scale, or the Supernatural Attitude Questionnaire. The second one is to elevate the help-seeking intentions across different resources like the formal, informal, religious, using the General Help-Seeking Questionnaire, GHSQ. The last one is to examine the association between supernatural beliefs and help-seeking behavior.
Third, for data collection, data were collected through an online questionnaire where students click on the link and then they receive the questionnaire and then they start to fill it. This questionnaire consists of three things. First, socio-demographic data including age, gender, academic year, residence, family history, psychiatric reputation. Second, supranational attitude questionnaire including 28 yes or no items, measures supranational beliefs. Higher score means stronger beliefs. Third, for general help-seeking questionnaire consisting of 7-point Likert scale ranging from 1 extremely unlikely up to 7 extremely likely, and this measures seeking help from formal, informal, and religious sources. If the score is less than 5, meaning that participants have low help-seeking propensity. If it's more than 5 or equal 5, means the participants have high help-seeking propensity. And this questionnaire requires from 7 up to 10 minutes so the students can fill it, and participation is voluntary. Means that anytime participants want to quit, it's okay, no complications will be taken. For statistical analysis, data were analyzed using SPSS program. Test used here was chi-square test, value categorical variables, independent t-test, and ANOVA value continuous variables. But the difference here is that independent t-test value continuous variables between two groups such as SAQ and gender, but ANOVA between the more two groups such as SAQ and academic year. Correlation analysis, personal correlation, referred to it as an R, and this value, the SAQ versus age. For significance, the p-value, if it's less than 0.05, means it's significant. If it's more than 0.05, means it's not significant.
A key question in our study was, do supernatural beliefs affect mental health help-seeking or no? The common assumption is that people with these beliefs would seek help from religious resources rather than professional resources. A total of 127 medical students with mean age of 21 participated in our research. The mean score of the Supernatural Attitudes questionnaire was 12.31, indicating a moderate level of belief. We first examined the relationship between supernatural beliefs and socio-demographic variables, such as residence, gender, academic year, and parental education. They all showed no statistical significance. This shows that these beliefs are culturally stable rather than influenced by individual demographic factors. In other words, these beliefs appear to be consistent among different groups of students. We also assessed the correlation between age and SHU and supernatural attitudes questionnaire, and they still showed no significant correlation. The p-value was 0.353 and the Pearson correlation coefficient was negative 0.084. Since the p-value is greater than 0.05, this result is not significant. The most important finding in our study was that academic year was the strongest predictor of help-seeking factor. First-year students showed higher level of mental health help-seeking other than senior students. They showed lower help-seeking behavior and more avoidance. In other words, as students progress through medical training, they become less likely to seek help. They become more avoidant. We also found that the completion of psychiatric rotation leads to lower help seeking, as the more the students go through the psychiatric rotation, the less they seek help. This is actually paradoxical, as we would expect psychiatric rotation to increase awareness among students and encourage help seeking. Instead, it appears that psychiatric training may unintentionally reinforce avoidance among students. Other factors also showed significant associations, such as female were more likely to seek help from informal resources. This may be explained by social and behavioral differences. Additionally, students with a family history of mental health problems were more likely to seek help. They don't fear stigma and they have increased awareness. Interestingly, senior students showed increased reliance on religious help. At the same time, they also demonstrated higher levels of complete help avoidance. This suggests that not just a shift in help-seeking behavior, but in some cases, completing psychiatric rotation will lead to withdrawal from seeking help altogether. In conclusion, supernatural beliefs were not associated with help-seeking behavior. Instead, medical training and academic year played a more significant role, and help-seeking decreases over time, while reliance on religious coping and help avoidance increase.
Moving on to the recommendations, first, how to apply it in the clinical practice. First, we should implement mental health awareness and anti-stigma programs in the medical education. Also, should promote self-awareness, self-care, and early help seeking in the medical education. For the future research, first we should conduct longitudinal studies to track changes over time and also use qualitative methods to explore the underlying motives. Finally, the policy and the guideline implications. We must ensure confidential and accessible mental health services, and also develop institutional policies that normalize help-seeking behavior. For the study limitations, first we use a cross-sectional design, and that allowed us to collect single data at one point at a time, but that limited us to establish the cause and its effect. Also, we self-reported the data, and that subjects the data to self-recall bias and social desirability bias. However, for our study strand, we used comprehensive assessment of help-seeking behavior, including the formal, informal, religious, and avoidance pathways. Also, we used validated measurement tools like the supernatural attitude questionnaire and the general help-seeking questionnaire to ensure the reliability. And lastly, we focused on the cultural context, including the Egyptian medical students, as they are an under-researched population. The last but not the least, for the ethical considerations, we made sure to obtain the ethical and administrative approval. Also, we made sure that informed consent was obtained from each participant. And lastly, we made sure that all the data were kept secured, anonymized, and confidential.